Good morning, everyone. On behalf of the PAHO Infectious Hazard Management Unit, welcome to our virtual session on pandemic preparedness and response planning for respiratory pathogens. The Caribbean has a wealth of experience from previous health emergencies, experience we need to now leverage to strengthen our national pandemic preparedness and response plans. This series of workshops aims specifically at updating these plans in alignment with WHO's Preparedness and Resilience for Emerging Threats, commonly known as PRET initiative. Over the coming sessions, we'll examine key preparedness elements, share regional lessons learned, and collaboratively identify practical improvements to protect health more effectively in the region. So before we get into the outline for today, I would like to introduce myself. I am Onella Cyrus, the IPC for Influenza Surveillance and Pandemic Preparedness for the Caribbean subregion on the IHM flu team. And I'd like to hand you over to Evelyn to introduce herself.
Good morning, everybody. I am Evelyn Balcells. I am the international consultant for all the activities related to pandemic preparedness in the unit. And I'm the PRET focal point as well, the initiative that we'll be discussing today. Joining us today as well from the team and to acknowledge their support are Natalia Acosta and Leanne, who are doing all the behind the scenes support. So thank you very much.
Okay. So today's session is basically going to follow the structured approach. We'll more or less identify what the expected outcomes would be from the discussions and try to engage you in some interactive scenarios that are basically designed to highlight practical challenges that you may experience when developing your emergency coordination components of your pandemic preparedness and response plans. After this, we would like to get into a brief overview of the PRET framework. So we will also dive a little bit deeper into the emergency coordination aspect of the PRET framework, as that is the focus for today's session, and end with some more scenario-based type of interactive exercises to get you thinking practically of how you can apply the stuff that we will discuss from the framework to actually updating your plans. I'm not sure if Leanne or Natalia could help us here, but we were hoping to also start with maybe getting just a short, picture of our participants here today to document the webinar. So if you are able to open your cameras, etc., so that we could do that at this time and then get straight into it.
Let me see. I was just looking at that, Ronella, but I don't know if by the format of webinar, they will be able to open their cameras unless we promote them to panelists, which we can do.
That's okay. I think what we'll do for now, we'll sort that out for the next session, and we'll
Okay.
just get into the info for today. But thanks a lot, Leanne. So Evelyn, on to the next slide. So our primary objective, I think, is very clear. We would like to support the Caribbean countries in updating and refining their national pandemic preparedness and response plans in accordance with the technical guidance from the PRET framework. So by the end of this workshop series, what we would like to have is each country having a working draft that reflects the global best practices, but specifically tailored for our local Caribbean context. And we're basically going to be doing these series of workshops where we try to focus on each one of the 5 C's that we will touch on a little bit later. So you really get the guidance from the technical experts in each one of these areas to help you to have these comprehensive, realistic, and most importantly, I think, implementable plans moving forward. So next slide. So let's set the scene here. Consider this scenario. A new respiratory virus has emerged in the Americas, and it would have been reported through the IHR chain to PAHO, and an alert was published. people are starting to get very antsy because it has been reported that the persons that were identified in this first cluster of cases came from the Caribbean on a cruise. And as we know how misinformation spreads quickly on social media, and all different platforms, it's starting to create a lot of buzz in the region. And a junior colleague asks you the next question. So at this point, we would like you guys to scan the QR code for the Slido and answer if you would have taken part. The first question there is if you had direct involvement in your country's response to the COVID-19 pandemic. The idea here is understanding the extent of direct hands-on experience among the participants here today. It would allow us to, better calibrate the discussions moving forward as we recognize that, the experiences within the group could also help us to maximize on that peer learning that we would like to promote for these activities. Give you guys a few more seconds to complete. Okay, so far it looks like everyone participated in their country's response to COVID-19. So we move on to the second question in the poll.
I'm just there are 21 people. Can we get a few more responses, at least half? Let's just wait for half.
Come on, guys.
You can also go to slido.com and enter that code, or you can scan
from your phones, yeah.
Phones. And we will be using this Slido session for the rest of our session. So you could just leave the tab open and we'll go back to it. Okay, we almost got there. So hopefully for the next one, we'll have more. Go ahead.
Okay, and moving on there, we would also like you to indicate whether you participated directly in the influenza A pandemic in 2009. Basically, comparing these two polls would kind of highlight continuity or changes in institutional experience so we could understand what gaps in preparedness capacity that might exist. Okay, so far, the majority of us have not. Okay. So we'll go back to the presentation. So our experience from previous pandemics provide critical insights, whether it would have been effective strategies or the actual hurdles, that we would have experienced in dealing with previous pandemics. We need to incorporate these things systematically into our revised plans. Right. So what we would like persons to do when going through the process of updating these plans is really draw on the lessons learned from previous plans and implement them in your strategies moving forward. So again, we're looking at the same scenario where PAHO and WHO would have issued an alert. So there's this emergence of a novel respiratory virus and it has human-to-human transmission. So what I'd like you to think on right now is, for your specific context, does that particular alert that would have been issued trigger some sort of what actions would that trigger in your context right now? So with that alert coming from WHO, send y'all into a particular phase of readiness or trigger particular actions, whether it's starting to have those multi-sectoral coordination meetings, etc. What would be the trigger for you activating your plan? So let me take you to the question here. The CMO has asked you to review the list of participants for an initial multi-sectoral coordination meeting. Who do you think should be invited at that getting ready stage, at that particular type of meeting? Who would you include in that meeting?
Please type any text
Yep.
that you would like to. The sectors at the left are just some of the critical sectors that are often
Guidance.
involved at some point, but not at all stages. It's just
Right, I like that persons are including port health in their responses.
a bit of an agreement here that we have different levels of primary clinic, veterinary, ports. It's mostly health
Yeah,
sector that we're seeing here, but at this stage, we have a few sectors outside.
correct.
Okay, just gonna wait for those participants typing to finish, and we can move on to. So it's very interesting here that at this stage, we're just getting ready, and we also we already have some tourism
Correct.
and civil defense already included here. Good.
I think examining some of these responses kind of highlights the existing coordination mechanisms that may be in place. That's why these would be the first areas that persons are touching on, but it could also highlight areas for expanded stakeholder engagement moving forward to ensure that we have improved intersectoral coordination. Okay, so at this stage, we will get into a little about PRET. So the Preparedness and Resilience for Emerging Threats, also known as PRET, it is a strategic framework that was developed by WHO, basically to streamline and strengthen national capacities to respond effectively to emerging infectious threats. And the core strength of this particular framework lies in the hazard-based approach. Instead of planning for, individual pathogens, it organizes the preparedness based on the mode of transmission. You could see that at the top right of the screen there. So this approach basically helps countries to leverage their existing systems and the expertise across multiple threats. All right, and this will significantly improve the preparedness efficiencies in country. The PRED guidance is organized into clearly defined modules, and we are currently using the respiratory pathogens module, and that's what we're discussing today. Right? It provides a clear guidance for diseases that are spread through, whether it's respiratory droplets or aerosols. So we're looking at things like influenza or other novel respiratory viruses. Additionally, they are currently working on the module that is specific to arboviruses that, again, would be very relevant to our context here in the Caribbean. All right, so this underscores the adaptability of the PRET framework, I think, and the scalability to cover a broader range of public health threats. It is, I think, a fundamental aspect of PRET is the explicit commitment to the all of society approach, right? The PRET framework really emphasizes the crucial role that is played by all sectors beyond just health. So whether we are including transportation, education, tourism, as some persons touched on, security and communications, the PRET approach really acknowledges this interconnectedness of these societal functions and ensures that our preparedness, our response, and the recovery phases are well coordinated across multiple sectors and stakeholders. So by promoting this multi-sectoral collaboration, we prevent that, that siloed response that we tend to have, ensuring that the actions that are taken during the emergency is synchronized and, mutually reinforcing. So we're not double working. It also addresses the entire epidemic and pandemic continuum, which I think is crucial. So we're starting from the preparedness stage, moving through the response stage, and very importantly, focusing on the resilience building afterwards, after the pandemic. So this comprehensive scope means that preparedness actions don't just include, that immediate response, that we're not focusing on the immediate response in our planning, but also the long-term capacity building, the risk communication strategies, the equitable access to medical countermeasures, and important recovery measures that will minimize social disruption. So in practice, PRET really is a detailed recommendation that includes identifying and clearly, delineating the roles and responsibilities of all the stakeholders and having those, I think, transparent mechanisms for whether it's resource allocation and ensuring robust communication and community engagement plans. Right. So by, I think, aligning our national planning with the PRET framework, our Caribbean countries are not only going to be improving their national capacities, but facilitating an alignment with what is now basically international benchmarks. So we'll be not just contributing to our regional health security, but global health security. And I know a lot of, you could go to the next slide, Evelyn. Persons tend to think that, they're overwhelmed by all these different frameworks, but the PRET really fits in well with other health emergency frameworks that we are already, implementing. So if we look at PRET and the IHR regulations, the emergency coordination component that we would like to focus on today, really supports meeting the IHR benchmark, the capacity 8, where you look at national health emergency frameworks. So it aligns with, promoting establishing a permanent multi-sectoral coordinating body, having defined terms of references, having that health emergency and operational center with sufficient search capacity, and very importantly, those legal frameworks and the resource mobilizations. So PRET explicitly supports countries in demonstrating measurable, I think, and benchmark progress towards ensuring that they meet those IHR requirements. And if we look into the Caribbean context specifically now, under CARFA, there's that regional health security framework. And that particular framework significantly strengthens, pandemic response capacity. And if we are focusing again on the emergency coordination components of PREDS, we look at the coordination components of the RHS. And that coordination component includes the regional coordination mechanism for health security that is supposed to provide that swift collective decision making, having that collaboration between the ministers, CMOs, CDMA, PAHO as well. And then also including the CARICOM security cluster, ensuring coordinated action, whether it's across immigration, defense, law enforcement. Having, CARFA situation room and lab network to offer backup for real-time epi data, the laboratory support, or even that GHSA roadmap that's supposed to align the external donor funding to national priority gaps that would have been identified through different assessments that have been done. The PRET also fits in with this, embedding that the regional frameworks into the national planning to ensure that we have comprehensive, coordinated and effective response. So I don't want persons to feel like this is just another framework they have to, add to a basket. It all works together.
Thank you, Ornella, for leading us to the subregional perspective. And I will just go into more about the what and the how. PRED goes about raising awareness about what's specific about respiratory pathogens, because these other frameworks are larger, right? Either for different threats, for different emergencies. So, and I know this is of interest to the region as well. How does PRED fit in with other specific national health emergency and disaster management plans? And it fits very well. If you read the technical guidance of, for instance, PRED and the multi-hazard framework, you see that they both make sure that we we ensure coherence, mostly for appropriate allocation of resources, but also for clarity of roles of different stakeholders, because that is what's most needed to coordinate during an emergency. However, a plan for respiratory pathogens is still required, because there are very specific needs for this biological threat, as we have all experienced and dealt with, as we saw in our survey. So in terms of PRED, to the left, you see there that we have the respiratory pathogens preparedness plan within a bigger national action for health security. And then there will be a much bigger just national health policy that addresses more than emergencies. To the right, you have an example of the technical guidance for multi-hazard response framework, where even though this response framework focuses mostly on the response, it also deals with the preparedness aspect. And you can see that there are specific plans where for different risks, it's recommendable that we have specific plans. So whereas it is an independent plan, or it is a part of a much bigger health security plan, you would have them, they're well aligned in all the technical guidance that you find from the organization. And I wanna, as I said, I wanna just delve deeper into the multi-hazard response framework, because I know it's of interest to some countries in the call. So here to the left, you have, again, we know that there's a continuum in the response, and this is the guidance for the multi-hazard response framework. To the right, you have what Ornella presented before in terms of what are the stages that PRED is recommended that we think of for our coordination mechanisms. And I want to focus on the operational stages here. In blue, when a virus emerges or it is introduced in our country, we are in that get ready and contain stage, which coincides with the activation of response in the multi-hazard response framework. When there's more community transmission, where it is sustained or completely disseminated, we are in a full response mode. We're controlling, we're reducing transmission, and we're trying to mitigate impact, social and health. And this is what in other frameworks might be called development of response. But again, we have here, we need leadership and management of the emergency. And then there will be a point where we need to scale down because the situation has stabilized, whereas through medical countermeasures or public health and social measures, or immunity or transmission has been so widespread and immunity has developed to this virus or this new pathogen, and there will be a need to reduce the response. And then obviously we go, but what we need to do in terms of preparedness is mostly in the interpandemic period, in those peace times, so when we are trying to prevent and prepare. So this is what we know we need to do, but how do we go about it? And this first, and I want to highlight 4 items. Obviously, we are here available for one-to-one consultation with countries, because this is very specific to countries, but there are 4 key messages that I want to highlight on how do we fit in these 2 frameworks. One, and it might sound very obvious, but it's very important that you decide on the country-specific structure that alignment needs to have, because that is within the norms of the regulatory framework. Is it an annex to that multi-hazard response framework? Is it an independent plan? And what is the structure of that? Because there are a plan in some countries might need to include some budgets, some timelines. It can also be a protocol, an SOP. So that's the first consideration to start drafting. what is the structure that we need to follow in our country. And it varies a lot in the region. Then what alerts levels, or sometimes they use the other language like operational modes or operational stage, are already defined for large emergencies. And how do this map to operational stages for the respiratory pandemic? Because for flooding or fires or an earthquake, the situation and the triggers will be very different than for a pandemic. We know that if it is occurring very, very far from our country, there are ways and social measures that we can do to get ready and to contain. It might start as a small outbreak, a small cluster, and there's some interventions at this point that will be taken to a geographic location. But then when we're talking about a pandemic, we're talking, by definition, it is that we're going to get to that disseminated community transmission. And so we need to make sure that at that stage, when the operational stage and other emergency mechanisms need to be activated, that our plan is aligned with that. And for respiratory pathogens, we have surveillance. And that's a very strong component of how we address infectious diseases. So it's very important that we think about how will levels of alert be determined and implemented to move from one operational stage to the other, one operational mode to the other. In the PRED document, you will find it as criteria or triggers to scale up or down. And for infectious diseases and for respiratory pathogens, we have some considerations that we may not have for natural disasters. So for instance, we have alerts issued by a global organization. We have IHR notifications. So we need to think about the criteria that make sense for our country. We have sentinel surveillance. Other countries might have event-based surveillance. So what is the criteria in our country based on our surveillance system and our risk assessment mechanisms, in which we say, okay, we've detected that there is a virus emerging in another site, and we need to start doing some actions. Okay, our surveillance is now capturing that we have, we are not at the stage where we can control this outbreak. We need to move forward. We need to scale up. And that's all in our surveillance system. So we need to make sure that if we're doing it as a part of a multi-hazard response framework, our respiratory pathogen, our respiratory pandemic preparedness plan, that we do consider that surveillance aspect. And then in most broader multi-hazard response frameworks, you will have steering committees and roles and functions already defined. So it's very important that we don't create confusion in creating new descriptions in a respiratory pathogen plan, but also that we evaluate at this point how well our multi-sectoral coordination mechanisms that are relevant for respiratory viruses describe, and motivate or promote updating if necessary. Just some clear examples of environmental ministry. Are they considered as a key pathogen, as a key stakeholder from which the health sector receives information? Because for zoonotic threats, we need their involvement. Our surveillance criteria involve genomics, syndromic, or public health and social measures, multi-sectorial coordination mechanisms present. So in summary, if plans for respiratory pathogen are being updated within a larger framework, which they need to be for coherence, my main takeaways to recommend from what we see in the region is first, decide on the country-specific structure, and then really look at the alert levels, map them to operational stages that we are recommending for the respiratory pandemic, identify those triggers based on surveillance and other laboratory, but also other surveillance mechanisms, and make sure that you assess the steering committees and roles and functions that are already described. And there are more examples of triggers in the document, and specifically the Annex 6, which can be useful when you're drafting your plan. And then we go in onto more specific other recommendations for strengthening emergency coordination. And Pred calls it subcomponents. So the subcomponent to the emergency coordination, the first one is policy. And first is to make sure that there are provisions to operationalize interventions for epidemic control. And that when you're assessing this, you take a look at, are there any gaps that allow me legally and our regulatory framework to do something that we know we need to do for epidemic control? For instance, contact tracing or data sharing. Are there official mechanisms in which the health sector is going to receive the information that we know that we need? And then we need to make sure that the policy in place has legal mechanisms to import, license, stock, and deploy medical countermeasures, because those will be necessary for novel pathogens or even known pathogens with slightly different characteristics. And this needs to happen in a much quicker way than we would do in non-pandemic periods. And the other item that was very, very clear during COVID-19 is that we have the legal mechanisms to implement public health and social measures. So if the health sector is going to recommend some quarantine or to the level of school closures or even tourism restrictions to prevent transmission, we need to make sure that we're also looking into the legal mechanisms that would allow us to support that recommendation. It might not be within the realm of the health sector to change that legal mechanism, but we definitely, we know that that's intervention that the health sector will recommend. We should make sure that we are in the interpandemic period assessing what are we allowed to do at the moment legally and what can we be prepared to recommend, and the changes are made to the legal provisions. For this, we need to conduct policy review and of laws, but also other health emergency plans that may support those actions. Then coordination. Here, the most important aspect is to determine who are the relevant focal points in different sectors. That might be, and we already saw a picture of that, and we're going to have the exercise to do more of this thinking of what are the interdependencies that are relevant for respiratory pathogens. There are some key stakeholders that are not in the common in the radar for respiratory pathogens. So we need to consider different scenarios to keep imagining where those different stakeholders may become relevant. And we need to have clarity of roles and functions and make sure that the plan that we're drafting doesn't contradict or add functions that are not already established for key groups. So for instance, the public health emergency operating center, if there's one in the country, or if there are terms of references for steering committees, there's no need to recommend in a plan to create other committees that are already established. And how can we do this? We can conduct network mapping exercises, and we consider the mode of transmission. So for respiratory pathogens, the issue is that it's so widespread and that we know that if we're dealing with a pandemic plan, is because we have all of society involved. And then financing and human resources are the other two subcomponents that for the coordination chapter is very important to consider. It is recommended that all countries have a contingency fund for preparedness, so that there is money to think about what we're going to do when the emergency comes. And we know that that's not a reality and not something that we can achieve just by writing a plan. But that's something that we can advocate during the preparedness period. In most countries have a mechanism in place for rapid dispersion of funds during health emergency. What our pandemic plan needs to do is to make sure that there's clarity on what are those mechanisms, how are they linked to broader plans, and that we are clear on what the organigram and who should be involved to call in for that rapid dispersion of funds. So that no new lines of budgets need to be created or some normative aspects need to be dealt with when we're dealing with the response. And for human resources, the recommendation is that healthcare workers are continuously trained on pandemic response activities. There's also that opportunities professional development. And perhaps it's relevant for an entire region, but very, very important for the subregion of the Caribbean, with small populations, small states, is that we have clear mechanisms. How do we gonna recruit staff when that capacity needs to be scaled up? Is it gonna be through temporary hiring? Are we gonna mobilize retirees? And can we have that policy and those norms and those processes already in place before we reach a pandemic? What can be institutionalized from what had to be done for COVID? How are we can we recruit private sector staff for some actions, for testing, for community outreach? How are we gonna redeploy or optimize roles of people when we need to scale down some other activities and focus on the respiratory pathogens response? And also, how our international networks or emergency teams are gonna be allowed into the country if necessary, and obviously if available. So for this, definitely the policy review needs to keep an eye on this, because this is really a critical part of coordination and simulation exercises. They can be done as workshops or even just intersectoral meetings with the education, with the defense, from the health sector, initiating proactively these meetings to review contingency plans from other sectors. What are they thinking? What is their plan when a pandemic occurs or when a large emergency occurs? And having those conversations during the interpandemic period is very useful to know what others are thinking, so that the health sector can be prepared to address challenges that may arise. The other two subcomponents that address planning and equity, and basically they can be summarized in applying lessons from previous pandemics to update our plans, and that we consider human rights and vulnerable populations in our revised plans. So I want to show you how, from the regional level, we're applying lessons learned from, or we're using previous pandemic experience. And this is a busy slide. I'm not going to spend much time on it, but the key message is that the unit did a review of available national plans, mostly for influenza, because the influenza plans contain aspects of preparedness. The COVID-19 plans mostly focus on response. We selected one national plan per country, analyzed it, and saw how they align with the PRED recommendations. For the region, the components with most comprehensive descriptions, that means at all levels, from the national level and subnational, were emergency coordination and collaboratory surveillance. The components with the least comprehensive descriptions were access to countermeasures and community protection. So there's a clear need to update plans based on the recommendations, also because all of the influenza plans that have some preparedness activities were developed before the last update is before 2018. If we look at the countries that are participating in this call, we have Belize, Guyana, and Suriname, and Jamaica. You see the components with the most comprehensive description is coordination, that mechanism in which we communicate internationally and also subnationally. The subcomponents with the least comprehensive descriptions is what policy, what governance context is supporting that coordination mechanism. How are we going to deal with human resources, especially increasing? And I think a topic that is causing a lot of discussion in Latin America is how do we scale down once we've recruited a lot of staff? How are we going to healthily release all the people who are in temporary posts? How are we going to go back to normal levels of activity for essential services after the early stages of the response? And as more focus has been given on gender and ethics and equity, I think the subcomponents in previous plans, mostly in influenza, don't really address how gender and ethics considerations are going to be made during pandemics. So there is a lot of room of improvement for these subcomponents. And so what we've done here is that we've scored the description level for each country, each subcomponent, and we can now see where we can go back, because we're not starting from zero. We have a lot of experience in the country from COVID and influenza. We have plans already written. So what's useful? What can we do? Where can we start there? For coordination, we have a good level for the countries that are already here. Well, then there's some gaps so that we can go to the guidance, the PREP guidance, and see what we need to consider and write, because obviously we've already done it with COVID. But now we want to go into a more exercise and get you involved thinking. We're going to continue with the scenario. We're going to go through each prompt will address a different operational stage. And we're gonna, just because this is a seminar on coordination and other sectors, we're gonna get you thinking on the on situations that involve other actors. So just gonna just please start going into the Slido, and we're gonna I'm gonna give you here the prompt. So investigation in country A that already had an outbreak for the index case revealed positive animals, including pigs, turkeys, and dogs in many farms, homes, and markets. So we're looking at zoonotic pathogen. So in your country, what logistical mechanisms are already in place for operational, not theoretical, not just a technical guidance? How are we going to go out and do One Health investigations, as we know that a country in our region has transmission, human transmission of an index case that has a zoonotic? And you can think of how are these joint meetings occurring? How are investigations in the field taking place? And also, how are data being transferred? How are the results from animal health laboratories being shared with public health authorities, if any mechanism is in place? So I'm just gonna go to and you can start writing your response. And it's fine if none. But this is the kind of questions that you need to think of. Is there any specific norm or a specific agreement that allows for that joint One Health investigations when we need to? So that's great. Informal regular communication. So I think our policy review in that case will show this is happening through just person-to-person communication, because you have a close contact. But if those posts are changed or that people retire, is that relationship not institutionalized going to be enough for the next persons to continue communicating informally? Oh, there are regional investigations teams. Public health should be done. So there is here we're talking a veterinary public health unit and program. So here there's a joint sign agreement and that One Health platform. So that having that structure. Here we have an ad hoc investigation. Ad hoc investigations are necessary, but can we have a generic, is it necessary to have a generic protocol to make sure, or that make sure that it's well documented to save time and to create some systemically collected data that we can use over time? Here you have an advisory group that is already created. So when drafting your plan, what you need to think of is, okay, this is the legal framework that allows me to call in the veterinary group, the laboratory, the animal laboratory health, and say, data will be received from this source. And the more detailed you can be, the more supporting evidence you can include, the more operational your plan will be and the most useful it will be. So I don't know if someone can give me time, Ornella, but we're gonna go back to the next question, as I see.
Oh, you're good on time.
Okay, so country A, obviously they confirmed finally that the cause of the outbreak is a novel respiratory virus, TOS flu A. As we said, it's zoonotic origin, and it shows genetic similarity to swine influenza from the same geographic area. Hospitals in country A are now getting overwhelmed. And a key reason for this is because a large percentage of medical staff have to be isolated for quarantine. 2 months after the initial notification, a case is now detected in your country X. And we have country B now, which is in the Caribbean, and decides to implement international travel-related measures that affect your supply chain and tourism. So we want to ask you, just obviously from the top of your head at the moment, what agencies will lead efforts to establish exit and entry screening procedures at points of entry? And what is the role of the health sector? So we're going to go back. And again, sometimes we feel like some of the feedback that we received from some countries that have already drafted their plan is that this is beyond the health sector. We don't control this, etc. Sometimes it is not possible for those drafting the plan to know everything. So we need to have these multi-sectorial meetings to say, well, at this point, we need to have some screening procedures at point of entry. We just have to say what we need to do. And this is what the health sector can offer. This is what we did for COVID. And once you have that written down, you can have conversations on, well, this is viable, this is not viable within our regulations, or actually will someone say, this is where someone else will step in and conduct it. So here, we should be tracking travel history and identify those comply with the case definition. How are we going to track travel history? Do we have the systems in place? Does the tourism and travel and points of entry authorities have the ability to provide us with that data? So that's the question we can ask while we're drafting our plan. And how does the health sector make sense of that data? Who's going to be there analyzing that? Obviously, it's going to be in a collaboratory effort. That's what we can think of during the coordination exercise. So here you have a port health team, a specific team that you can already name. So here you have another actor, Ministry of National Security, and they will lead the control of ports. So you already know. So this is something that you can already point towards, because I'm sure there is a normative or a regulatory framework that establishes their role. So what health does here is that make sure that the case definition is used. So for that, we need to make sure that the health sector has published a case definition. It has disseminated this case definition to not only our GPs and our primary health centers, but also to other people who are going to use it for other purposes rather than taking care of case. And I can see the answers that I have in Port Help or Health. Here, you have utilized IHR for early warning system and network. A great example. Here is direct lines to report suspect cases. In this case, this was in a country that is developing the final draft. This was also included. And when it was put on a simulation exercise, there were a lot of questions of where the funding for the direct lines is going to come from, who is going to staff those lines, because it would go directly to the firefighters department at that point in that country. So we need to think, okay, this is what we need to do. How are we going to coordinate, and who is going to take it? Who's going to take those calls? Or are we going to have to staff a new call center? And +1 system for reporting requirements. So if we are here, we already have systems in place that we need to refer to. It is what's going to make our plan most effective. Yeah, airport authority operationalize, definitely. So there's probably going to have to be some training. So the health department will probably have to do some training or material resource development so that the airport authority can staff those screening points. This is probably something that is very common, not only for a pandemic, but for other outbreaks of different levels, other emergencies of other levels. So it's definitely, there's experience that we can leverage. We just have to make sure that that's included in our plan, and that when we're drafting, this is the sort of thinking that we need to follow. Okay, so unfortunately, now there is dissemination, widespread dissemination, and just community transmission in your country. There are 2 questions here. We're going to start with what's required to inform school-related interventions, including closures, unfortunately. And who makes the decision about closures? So, go back. So school closures is it's a public health social measure that is unfortunately needed at some point, maybe not because of specifically transmission during schools, but because some movement restrictions need to come into place that affect directly schools, and that affects entire society functioning as kids have to stay at home, etc. So when thinking about our coordination, this is just an example of a public health social measure that is common in all countries. So obviously the education ministry, they're most likely going to have a contingency plan. the question here is to have they have a contingency plan for flooding or a fire nearby, and when they have to do more limited geographically closures, when they have to do temporary closures because of another emergency. But do they include a pandemic, a widespread long-term closure? And that's a question that we can ask definitely in interministerial meetings during the interpandemic period. So here you have school closure decisions that are made by the Minister of Education. And we advise what evidence, what we can plan for in our plan is what evidence are we going to provide within our surveillance abilities at the moment, our capacities in the country, that we're going to provide the Ministry of Education. In some countries, in my experience in Latin America, it mostly goes down to the cabinet decision. And so obviously it's a decision that goes outside the health specific emergency operations center, but they need to be informed on surveillance data. Probably there's an agreement here, but we have to look into our regulation to see. And in the guidance, you'll see that there are some public health social measures that are often needed, like border control, or that are often will get to the point where they will have to be considered during a pandemic: school closure, restriction of movement, institutionalized populations. So we're just using an example here. Now let's go back to our presentation. And we're gonna go just kind of to start to think. There are two different questions, but you start thinking about the two. We have disseminated community transmission. Probably a lot of your staff are going to be impacted by this, because a key characteristic of a respiratory pathogen, unlike other health emergencies, is that the health staff is particularly at risk. As patients come in, even if they have or not have the disease at the moment, the health services get overwhelmed. They are obviously at risk of transmission, and even though some prevention measures are probably more readily available than for the community, and they're better trained to use those measures, they are constantly at risk, which doesn't occur, which is a key difference with floodings or fires, where you have your entire staff at risk. So what methods are in your country to address staff shortages? And then what are the procedures to scale down? So we're gonna just see your responses. And something that was very thought-provoking in a simulation exercise in another country was everybody in the room had been involved in the COVID-19 response. And the question that was posed was, what would you tell the new generation if the next pandemic occurs once you've retired, hopefully? So that's the plan. How did we recruit people when we needed during COVID, in urban areas, in rural areas, and what was left unattended, and what we could prevent to live this time? So retired personnel were calling And what burden does that pose to human resources and admin teams to make sure that they have all the credentials and they have access to different hospitals and or login keys, a lot of training, that they have access to the technology, like the computer systems. Here you have tax shifting, scaling services, revoke vacations. Is there a legal framework? What the legal framework at the scale that we needed for a pandemic? Graduate students, and how do we deal with all the legal issues that can arise from including students that they need to be retired nurses. Yeah, thinking about the entire scale, especially for like when we get to the point of community-based diagnosis or vaccination, right? Like how do we scale up that workforce? Temporary contracts, volunteer organizations that will vary in size in each country. So are they a source of scalable workforce in your country? If yes, they are. Yeah, here you have volunteers. And so we know that these mechanisms, these methods might need to be implemented. So just developing a whole systems to obtain volunteers. Can we prepare for that? Even if it's just the online form on how we're going to get the first initial express of interest. This is something that we can prepare during the inter-pandemic period. Cross-training of staff that have to happen. It's better if it happened during the inter-pandemic period. Yeah, lengthen working hours, but then how do we make sure that we have enough resting time? So that's obviously you're gonna get all these notes from this meeting. We're just doing the exercise here. And and the next question, and just final before, is how do we scale down? How do we healthily scale down after the situation has stabilized? And it's a question that is gonna come up in all the components. In again, just from experience of people drafting plans with this new guidance is, yes, labs were at the capacity. How do we go back? Vaccination was at the highest level it has ever been. We're reaching places that we have never been, but we could only take one antigen. How do we take all of the antigens? So how do we then go back to what's healthy and feasible in the system? For scaling down, a lot of the coordination is just going back to the specific components. For scaling down activities, these wider plans are often where the mechanisms are already described. So we just have to make sure that we find that recovery phase description and that we consider it for our respiratory pathogen. It's not documented. Assessing and if there's possibility to integrate some of that workforce. That is. Obviously, there needs to be an institutional, organizational reduction of activation levels before you can move forward with any human resource activity. So it won't have. So you have to know that you cannot start saying we cannot have you here as a volunteer anymore until a certain level has occurred. And yeah, people need lead time to absorb that change. Someone here is saying to make sure that we are baseline level. What did that mean for a pathogen that has now become endemic, or where we know that is a new variant might come up. So we know that we might need to scale down now, but who knows, because we're seeing an elevation or increase of activity in other countries. So we know another variant might come in. And so we have to make sure that it's temporary scale down and outward, and just seeing how the system can cope with that up and down waves. The idea when you're drafting the plan is that you think about pathogen X. It's not a clear influence that we're going to get the vaccine, it goes down. It's not another coronavirus similar. It's just not another variant of SARS-CoV-2, and that we will be able to modify the vaccine. Is what do we do for a pathogen of unpredictable characteristics, specifically severity and virological characteristics. Yeah, so here we have to be creative and just say the first step would be to reassign workers, because we might need them again, instead of scaling down and dismantling the whole workforce the whole capacity that we've established. Here, and this is great, is like how you cannot scale down the workforce, especially not within the public health, where we're heavily coping with the brain drain, and you have to consider sub-regional issues where there are very few people who are trained to do the work that you need. So is it possible to scale down, or do you actually have to make changes to the system and continue delaying non-emergencies? So instead of scaling down, you're gonna, or because you were not able to scale up, are you gonna have to continue delaying some services, or you're gonna have to continue centralizing some activities? So if workforce cannot be increased, what happens with the system? So I'm just gonna wrap up so we have time for questions. Just as closing remarks, in PRED for your draft, there are 5 specific, if you want to say, paragraphs or items that you can focus your writing on. And the first one is what we talk about, the review, policies and other health emergency plans, how this plan fits with others, because there you're going to find a wealth of information that you need to make sure that the pandemic preparedness plan is effective and operational. Then describe those, a lot of the funding information, it's already probably written somewhere, because for the pandemic level, it's a full-blown emergency. So what are the triggers, but who needs to give the instruction, and what is that command and control structure that would say we need to release this funding, mechanisms and measures for the funding. For that, I think you need to identify the most updated policies, and just say, well, this is how human resources temporary contracts can be funded, etc. It will be there, and it might be written in a way that is for any disaster, and then you can put it into your risk-specific plan. And then you need to describe that coordination mechanisms with other sectors. And for that, I think what Ornella mentioned, that for respiratory pathogens, we already have a wealth of information that we can just consolidate. The IHR, the subregional initiatives, but also our annual our One Health and surveillance activities, because this is where we already coordinate with sectors that are relevant for respiratory pathogens. How human resources will be surged. And I think here I would like to just prompt, whenever you're drafting your plan, that sometimes we need to think about increasing representative of stakeholders. However, someone mentioned volunteers, someone mentioned community organizations. Sometimes we just think about our health regulated sector, but sometimes we need to think broadly and how are we going to get those community facilitators or community leaders involved. And for that, we can use different scenarios, situations for and map that network. And then we're gonna identify. The question that we ask sometimes is, what happens to children during a pandemic? And then you see, well, some children will go to school, some children will stop going to school, and what's going to happen with them? What happens to people who are institutionalized? Well, they won't be able to receive this sort of service. So who is going to go in and how often they're going to go in? So thinking about those scenarios and mapping those networks is what's required for your national specific considerations. So I'm just going to leave it at that for questions and answers. But this is the outline that we recommend, and these are the considerations that you need to have for your coordination, emergency coordination section of a plan. And I think everybody's in the session now, so we could actually take the pictures while people think of their questions. So if you want to turn on your camera. If you want to. Okay, I think, Natalia, can you tell us when?
Yes, I'm waiting for more people to turn on the cameras. You can tell me when, if it's okay now.
Yeah, I think it's okay now.
Okay, so okay, get ready everyone. Stay still for the picture. Just one moment. Another one. Oh, sorry, another one. That's it. Thank you.
Thank you, Natalia. As Evelyn mentioned, if anyone has any burning questions, comments, anything they'd like to share at this time, feel free to raise your hand and open your mic.
I don't think there are any burning questions. Madhu, no? No.
I'm just been wondering that actually we, as you already been said, we have COVID-19 plan and we have respiratory guidelines in drafting. So I've been thinking how to integrate that to one. So that's us.
Just wanted to say, Dr. Gomez from St. Lucia, I think it was a very good session. I mean, we've been through PRETS before at other workshops, But this one was quite insightful for me. We, like Madhu said, we do have our influenza plan, which is a bit outdated. And from that came the COVID-19 plan. And for me, some of the gaps that I do see based on this presentation is the getting the emergency funds, the triggers for the emergency funds, because it's always difficult to get a fund when you have the pandemic. They do come about when everything is rolling, but that is an area for us on our plan. And currently our disaster coordinator is having a workshop in May, where I think we will be presenting, we will be presenting on our COVID-19 plan and our influenza plan coming out of that. And also for me, the addressing of the gender issues and the vulnerable groups are some gaps that I see in our plans as well, which I see coming out of this this webinar today. So thank you for that. So these are two areas that we will be working on. Thanks.
Yes, Dr. Gomez, we will see you in May for that workshop. And this is exactly what we wanted you guys to get out of the session, to be able to actually identify the areas that you can, start working on, start actioning, start updating in the plan, and not just be another one of those sensitization sessions, because we know a lot of you have been already introduced to the PRED framework. So the idea with these series really is to start to go into the details, into the areas that you should be considering, whether it's updating the existing outdated plans, or if persons might be developing an annex to, like a multi-hazard plan that did not deal specifically with like a respiratory virus plan. We really want to give you all that detailed guidance for going forward, making these updates in your National Pandemic Preparedness Response Plan. So happy to hear that those areas stood out to you today.
Thank you.
And just to follow up on that, we also want to make sure that PRED doesn't look intimidating or overwhelming, and that you see it as a as a useful tool to say, okay, I have, what should I be thinking about gender in my plan? And that you go in and check those subcomponents specifically and say, this is not what I have to address in a plan, but how are we doing this? Just as a thinking framework, as a what can we do to make sure that our plan reflects what we're already doing? Because a lot of countries are collecting data in sex segregated data. Okay, what we're gonna do is that for our reporting during a pandemic is that our dashboard, our bulletins are gonna be desegregated by health, by sex. And so we can say, like, so in our plan, we say during the disseminated transmission stage, reports will be more frequent, daily reports, and they will be on sex-based, the segregated data. And that's going to be that's going to allow that's going to inform interventions locally, nationally, but we already have that surveillance, that capacity. It's just thinking about it, how we're going to use that during a pandemic. So what PRED is going to give you, and I would like to see it, is like a checklist. It's like, have I considered this or not? And then move forward. And I think, as both you and Dr. Gomez and Dr. Rojan mentioned, is how are we putting the COVID plan with other things together? And so it's like, PRED can help you do that. Say, well, I have this in my COVID-19 plan. This is mostly what we did for the response. What could we have done to prepare for this that we end up doing? Because the funding came through at the end. What was needed for this that we actually did? Because we already have it in a response plan. And then go to PRED, see what it says about funding, and it will give you ideas and some guidance on how to do it. Iana, Dr. Will?
Right. So what struck me as well, thanks so much to Ornella and Evelyn for the presentation. What struck me as well is that while we're working on our on strengthening IHR core capacity, hi Dana, Dana. While we're working on strengthening the core capacities for the IHR, while we're working on updating the plan and going through the processes involved in updating the pandemic preparedness plan using the PRET approach. It also is simultaneously helping us to strengthen the IHR core capacities, for example, for C1 and I think C2. So we can actually map the yes. So what I missed the first part of the webinar, so I may have missed that. But in turn, we can actually see results right away just by going through the process. We can see results hopefully in the next ISPAR for those countries that have not done so well in terms of the level that we currently are at. Then we can see results just from going through the process and putting things in place, putting things on paper. So that was just a comment.
Well, thank you so much to everybody. I think we're gonna just close the seminar, but I wanted to just let you know that Ornella and I are available for any one-to-one country-specific discussion that you would like to have. We are supporting countries reviewing their drafts, like what you've written, making sure that we provide some feedback on and just so other person to think about what am I missing and what is really strong, and we can relay also to, and we can or have joint discussions with the different advisors for each of the components at the regional level to make sure that they know what activities and the technical cooperation that you're doing with PAHO are you conducting in peace times, and how you can search the capacities, how you can strengthen them for pandemic purposes, for pandemic response purposes. So we are available at that. You will have direct contact with each of those advisors in the next sessions. And we're happy to continue working on the drafts. If you already have something that you would like to share, don't hesitate to send it to us, and together with the focal points in your country, we can work together and making sure that that plan is aligned with recommendations. And I'm happy to support. Ornella, if you want to just for the final words.
I echo Evelyn's sentiments. It definitely is a process, but we are here to help you, point you in the right direction, whether it's finding the right technical tools, the right documents, etc. And as Evelyn said, reviewing, giving you recommendations based on the experiences of other countries who might be further along in the process, what they've learned in updating their plans and testing their plans, etc. And we really hope that as you participate in the other sessions to come, that the other areas in the 5Cs become a lot clearer for you in updating your plans as well. And we hope to see you guys again in the next session, which will be next week, I believe. Yes.
Next Wednesday.
Next Wednesday. So
Same
if
time.
that's it, we'd like to close. And again, thank you so much for your time and your participation this morning. And we hope that you have a good rest of the day.
Thank you.
All right. Goodbye, everyone.